Ya. Silakan.
Kesana Pak.
Oke.
Oh, sini.
Nah, sini. Ya. Ya, cukup lagi ya. Oke, ya. Oke, pas.
Oke, selamat pagi para peserta seminar dan Orthopaedic series yang diadakan di atas kerjasama perkumpulan profesi manual manipulatif praktisi profesional.
Sebentar, Prof. Imam, sebentar, Fitri. Sebentar, ini kejauhan. Fitri kejauhan. Prof. Imam kejauhan, Pak.
Pertama-tama yang kami hormati Ketua dari Perkumpulan Profesi Manipulatif Praktisi Profesional, Bapak Imam Waluyo. Yang kami hormati Profesor Dr. D.L. Kana selaku Vice Chancellor Rachna International Institute of Research and Studies. Yang kami hormati Profesor Serta selaku Founder of Academy of Orthopaedic Manual Physical Therapies. Yang kami hormati Dr. Yovina selaku Medical Doctor dan Product Manager dari UniHealth. Yang kami hormati Bapak Arsyad selaku moderator pada hari ini, dan yang kami banggakan Bapak Ibu hadirin peserta seminar dan Orthopaedic selaku series dengan topik The Role of Myofascial Hand in Manual Manipulative yang patut berbahagia. Pertama-tama, mari kita panjatkan puji syukur kehadirat Tuhan Yang Maha Esa atas berkah dan karunia-Nya. Kita dapat berkumpul di ruangan ini dengan keadaan sehat dan berbahagia. Pada hari ini, tanggal 14 Januari 2023, kita akan mengikuti serangkaian acara seminar dan workshop hybrid series dengan judul The Role of Myofascial Hand in Manual Manipulative. Acara ini diselenggarakan dan didukung oleh Akademi Fisioterapi, Yogyakarta Yayasan Cahaya Kadima Kumara, dan UniHealth Solobuta. Perkenalkan, saya Fitri, selaku MC pada acara pagi hari ini. Susunan acara pagi hari ini yang pertama adalah pembukaan, kemudian dilanjutkan dengan sambutan dan penutup. Berikutnya sambutan akan disampaikan oleh Bapak Imam Waluyo selaku Ketua Profesi Manual Manipulatif Praktisi yang dipersilakan.
Oke, para peserta yang saya hormati, speaker, English speaker, Profesor Kana and Profesor Serta, and my colleagues, Dr. Muhammad Arsyad. I said thank you for your participation and you sharing your knowledge. Pada kesempatan ini menjadi satu kesempatan kita dalam kerjasama meningkatkan keterampilan manual manipulatif yang ada di Indonesia. Pada kesempatan ini juga seri daripada manual manipulatif antara lain ada sekitar 58 topik yang diperkirakan akan memerlukan beberapa seri. Mulai dari pertama hari ini adalah the role of myofascial change in the manual manipulative, dan besok tanggal 28 kita ikuti lagi tanggal 10 November dan Februari dan tanggal 25 Februari. Pada kesempatan ini saya ucapkan terima kasih para peserta yang telah hadir pada kelas interaktif di gedung UniHealth hari ini, dan juga teman-teman lain yang tidak bisa ikut interaktif di kelas interaktif, tapi paling tidak mengikuti secara online, sehingga diharapkan bisa ikut level yang online, artinya hasil full dan sertifikat dari AMPT. Karena secara prinsip kita bekerja sama dengan AMPT. AMPT itu International Association dari manual manipulatif, dan juga ada IPAM, itu juga internasional yang banyak dilakukan fisioterapi. Manual manipulatif ini merupakan satu keahlian. Kalau di Australia ini sebagai postgraduate dan fisioterapi sebagai manual manipulatif, tetapi di beberapa negara yang bentuknya potongan-potongan kecil seperti yang dari India ini. Saya kira itu yang bisa saya sampaikan, dan sekali lagi saya ucapkan selamat mengikuti webinar kali ini. Serialnya akan panjang. Nanti akan sampai intermediate sampai advance-nya. Saya kira demikian. Saya ucapkan terima kasih dan thank you Profesor Ana, Profesor
Dari sini
Serta, you will come to give us manual manipulative. Thank you for your contribution.
Terima kasih kepada Bapak Imam yang telah menyampaikan sambutan untuk acara pagi hari ini. Berikutnya, memasuki acara inti, yaitu pemaparan materi dan workshop yang sekaligus diskusi tanya-jawab. Acara ini acara ini akan dibawakan langsung oleh Bapak Arsyad selaku moderator. Acara akan berlangsung pada pukul 10.30 sampai 13.35 siang nanti. Kepada Bapak Arsyad dipersilahkan.
Oke, Mbak Fitri, terima kasih. Thank you so much, Profesor Imam. Thank you so much for everyone in this. I just want to restate again what Professor Imam said because we have problem to hear very clearly what he said that. Thank you so much, Professor Kumar, Senthil Kumar, and Professor Kana for your participation in this very important event. So, okay, thank you so much again, Fitri. Terima kasih. Let me start. Professor Kana is well known in Indonesia, so and then also his biodata, CP. Has been shared to the faculty members for the participant. I mean, okay, Professor Kana will talk about the relation of fellowship physiotherapy sport with manual manipulative based on the physiology of manual manipulative. Yeah, Professor Kana is professor in this area. So, Professor Kana, are you ready, Prof?
Yeah, okay, I'm ready, Professor.
Okay. Yeah, I just one request, Prof. Please speak slowly.
Okay,
okay. Slowly, so
can you see my slides here?
Yeah, very well, very well. Okay, Prof, over to you, Prof. Over to you.
Thank you very much. Thank you, Professor Arshad, Professor Imam, and my colleague, Dr. Senthil, and other colleagues from Indonesia, and the delegates. It's really a great pleasure to be associated with Indonesia, and we have been doing a great collaborative work also along with Professor Imam and other institutions. And Manav Rachna has been associated for different causes.
Can you unmute the video, sir?
You want my video? I'm not in.
We want to see you.
Can you see me now?
Yes, sir.
Thank you very much. I thought I'll show my slides basically.
No, you will be visible with the slide. Both.
Thank you very much. Thank you,
Sir.
Professor.
Perfect.
It's really a pleasure to be associated, and we have been working in various collaborative research programs as well as organizing seminar together, and also attending various conferences and talks, discussions. And in the initial, now in last this 4 or 5 months, we have evolved a program on fellowship program of sports physiotherapy, which is really a unique program where this Indonesia and India will join together and we will work together for the promotion of sports physiotherapy and giving the recent trends and knowledge about the sport physiotherapy jointly. And we have worked out a really good program in that I hope it will be very, very helpful to all of us. And that will, again, that basic aim was to develop the advanced skill in understanding and application of principles of sports condition. You know that sports is a really a challenging world where the physiotherapists are playing a dominant role, basically. Every coach has wants physiotherapy to stand with him. And I think when statistics was taking, the out of the sports personnel, they were asked that what do you need? There's every 99% said we need a physio also along with the coach. And that's how the physiotherapy has penetrated. And really, they have worked hard to convince these people that we are required. And now the demand, when it has increased, the skilling is also important simultaneously. If we have to have sports physiotherapists along with the coaches for the athletes' development and keeping in injury free, we have to see that what skills they should have when they are working with the team national high performance sports, particularly not only high performance but other sports person also. And that is what we thought of initially and then framed up various requirement of that the sports physiotherapist, how they should work. And we have evolved a 6-month program, fellowship program, which we will be conducting jointly with the help of the various experts, those who have got experience of working with the sports person and understanding the demand of sports person as well as of the competition, that they have to be kept. We have to really understand that the risk factors which are in the particular sports discipline, specific sports discipline, how to really evaluate that, how to plan for them, how to improve their muscular abilities or the other functional abilities so that they can meet the challenges of those sports, which is at the highest possible level. We know that Olympic is the best possible, where our people are contributing and are preparing for long term. So it is that how do you really prepare the strategy for injury prevention. And it is not easy simply that if we are sitting as physio outside the arena and only looking for that, okay, when they will have some injury, we will manage. But, prevention part is very that they are already prepared to tackle certain things and their body is also prepared for that injuries will not happen to them in case they go for this kind of set. And the physios have to have their only enhance the clinical competency, even if they are injured. How do you really manage those sports injury? And what all those latest evidences are available, what all those techniques are available, which you have to evolve and maybe your own programs also you can make it by doing lot of evaluation techniques and then planning based on their own individualized training programs. And in this program, what we have done is various highlights, which I will tell you that it's a good program where the online, offline theory classes will be taken by the experts from Indonesia and Indian experts, as well as across the world also. We have also requested few experts that they will be participating and they will be giving their own experiencing, sharing, and even conduct some workshop in some techniques which are evolved or which are very, very important at this moment, including certain performance analytics part, which physios should know. And also we have also requested some coaches, those who have worked with the international sports person, they can also be a part of that and they will be interacting with these fellows. And they will be, of course, renowned national, international instruction from the field of physiotherapy and the allied health sciences areas. What is major our concern is that how to do that the hands-on practices. the practical session, which will not only focus on the laboratories evaluation purpose, and then the working in the field, that combination of that from the lab to the field to the lab, that kind of approach has to be evolved. So it is not only a theoretical model, it will be a more of the practical model. The students will have to work in the field, bring their own problems, highlight those problems, discuss those problems with the expert, work out the solution, then have some kind of, their practices according to those solutions, and then maybe keep interacting with those experts. So that is an interactive program which is based on the evaluation in the laboratory in certain advanced equipment, which in India we have in our university, Manav International Institute of Research and Studies, and also in Indonesia, they also have a bigger facilities now evolved. So jointly we'll be working, and these resources will be mobilized from various other resources other than what we have also. So which is the latest trend which is going on in evaluation as well as application part. And the simultaneously we'll be giving them clinical exposure at different centers of sports and across India as well as Indonesia if they have, and nearby academies also will try to see that they work in those academies whenever they have some time also. And the major equipment which we have from the angle of biomechanical and sports analysis point of view in our university, that is a kind of isokinetic, Prokin, trunk, MF, Walker view, postural bench, functional line, all those equipment which are the latest model we have is a setup of this model. There is this equipment in our laboratories, and these students will be working in that. This is planned in such a way that, okay, they will be here for 3 to 4 weeks in our, in India, wherever they are from, maybe Indonesia or other parts of the world. And also Indian students, they will come for at least 3 to 4 months, and we will be training them on this equipment and teach them also interpretation, not only interpretation, but also now the weakness, how do they really work with the people. And since we are working with various international sports persons from across the world and Indian sports person also, particularly the shooters are being trained in India, in our university itself. And in the other part, other sports also, they keep coming and getting our advice and evaluation reports, as well as prescription for future training, as along with the coaches. So we will be training them and giving them the practical exposure to working with the high performance sports, and training in novel method of the treatment of sports injuries by experts, which is very important. One of the thing which we are, Dr. Senthil, our expert, is with us. He will be teaching us the mobilization and manipulative technique, which is again one part of that, and our experts will be just interacting. That's in the sports also, this has come up now, that this how to do this manipulation technique, which can be really helpful, along with this various aquatic therapies, dry needling, etc., mobilizing, and the latest clinical apparatuses also, which are being utilized by us for the treatment of the high performance sports people. So in these are various highlights, but beyond that also more of this, that a culture of that will be created for the students' benefit, where they will get the exposure as well as the practices. These are some of our instructor already with us, and Dr. Sumit is having very experience of more than 15 years working with the national sports person. Dr. Irshad is our faculty here, and already Dr. Shitija is having another 15 years of experience. So they are the sports, they're working with the sports person and training the physios also, in particularly sports physiotherapy, where we have already program of Master of Physiotherapy program and PhD program ongoing in the field of sports physiotherapy. So that is an additional advantage of working from the research angle or from the analytical point of view. Along with these experts, they will be always available for the advice. But besides that, we have connected with the various national physiotherapy working with the national team. They have accepted to be part of this whole instructor being a part of that instruction, and they will be associated also. From Indonesia, I'm very much happy that Professor Valio in the Imam Valio has really taken a big team we have the expert, they have the expertise of working with the international of Indonesian team as well as some international exposure also. Dr. Imam himself is a great physio, and Professor Harry, I met him, he has got a huge, wide experience of working with the sports performers basically, and still working also, And Dr. Arshad is with us now today. He will tell us also that he has got the whole expertise and experience. Dr. Eskinder, I heard him 2-3 times, and he has got really expertise in the various areas of sports domain and sports medicine. Dr. Sagarto also I could get him also, that he is very good expert in this. All are associated now. They all are international instructors as well as from other countries. From Malaysia, my friend Dr. Alexander, he is a training method expert. He is expected to be the part of this team for the sports physio fellowship program. So it will be a bigger program and in a unique program across the world. I didn't see this kind of program now. This is Professor Imam has really, taken bigger initiative from Indonesia that we should join together, and international experts should give the feedback to the upcoming physios, those who will be working with the sports person. Professor Arshad, you will like to just have this part first? You can just add on in case you want, or Professor Imam, you can add on.
Yes, Professor.
Yeah.
Yes, Professor. Can you hear me?
Yeah, I can hear you.
Okay, wait a second. Let me just see what is important you have said. There are two things. There's objectives of the program. This is really important. Okay, teman-teman semua, ya. Jadi Profesor Kana sudah menyampaikan ke kita tentang program detail, the objectives of the program. Ya, beliau sudah menyampaikan yang pertama adalah to develop advanced skill in the understanding and application of principle of sport conditions. Jadi beliau sudah menyampaikan bahwa program detail ini adalah untuk mendevelop, peningkatan kemampuan, skill, dan pemahaman, let me say that it is cognitive and psychomotor, ya, skill, dan aplikasi dari prinsip daripada sport condition. Ya. Ini yang the first objective. Yang kedua adalah untuk memahami risk factors, ya. Risk factor contributing to the sport injury, faktor-faktor yang memberikan kontribusi terkait dengan sport injury, dan strategi-strategi terkait dengan injury prevention, pencegahan injury. Ya, itu objektif yang kedua. Yang ketiga adalah meningkatkan clinical kompetensi, ya, dalam manajemen sport injury, dalam menangani kasus-kasus sport injury dan evidence-based practice model related to sport injury. Ini yang program detail atau objektif. Yang kedua adalah, Profesor karena sudah menyampaikan, yang kedua adalah program ini yang paling penting, highlights. Ya, this is really important, highlight. Beliau sudah menyampaikan adalah online dan offline kelas. Kelasnya dilakukan secara online dan offline. Ya. Kemudian yang kedua, di program ini akan diselenggarakan oleh para pakar, expert from both India, mostly from India and Indonesia. Ya, instruktur yang sangat paham benar, is really they are really expert related to field of sport physiotherapy. Ini highlight yang pertama. Yang kedua adalah practical session focusing and field visit. Jadi maksudnya begini. Praktisnya itu benar-benar fokus pada laboratorium, kemudian di praktis field visit, ya field visit. Jadi pengalaman di institusi-institusi kesehatan, ya. Kemudian ya ini institusi kesehatan ini ya terutama institusi ini klinik different sport center, beberapa sport center yang ada di India, ya, yang ada di India. Kemudian teknologi yang terbaru, updated teknologi yang terkait dengan biomechanical and sport performance analisa sport performance dan biomechanical, ya, isokinetik, ya, even prokin, ya, trunk MF, Walker view, postural branch, functional line. Mungkin nanti teman-teman para partisipan bisa menanyakan. Sorry, Professor, even me, some of this I don't understand what is isokinetic prokin.
These are the equipment, these are
Yeah. So I asked
for
participants
analysis of various
to ask question if
movement
they
and muscles, and of course the other aspect of postural aspect.
Oke. Saya mengharapkan partisipan untuk menanyakan lebih detail hal ini, ya, terutama peserta teknologi terbaru, updated teknologi related to biomechanical dan sport performance analysis. Silakan ditanyakan, ini sangat penting. Ya, training in novel methods, metode yang sangat bagus dan terupdate, ya. Kemudian treatment dilakukan oleh orang-orang expert yang berkaitan dengan sport injury, ya, terutama ya yang trends. Ya, trend artinya terbaru, hal-hal yang baru bagi kita, ya, terutama aquaterapi, mobilisasi dan teknik-teknik manipulasi, dry needling dan sebagainya. Jadi ada dua hal yang sangat penting yang sudah disampaikan oleh Prof. Kana yang terkait dengan objektif daripada program ini, kemudian highlight apa yang penting dari program ini. Ini yang sangat penting. Tolong nanti teman-teman kalau ada yang mau didiskusikan, ada yang mau ditanyakan, bisa nanti menulis di chat atau nanti disampaikan langsung bicara aja dalam bahasa Indonesia kalau belum confident bahasa Inggris, nanti akan saya terjemahkan ke Profesor Kana. Yes, Professor, this is really important for them. Thank you. Continue.
Thank you very much. Thank you. And the basic thing, which is one of the thing which Professor Imam suggested me to briefly give some outlines of that how this manipulative and manual therapy has the basis of physiological basis of manual therapy.
Yeah.
So in the sports is such a way where everyone is having injury from very small injuries to the various highest possible injury possibilities are there, and the technique which have come up in the recent, they can really deal with the patient in a very effective manner and without even the electrical appliances which they were using, electronic appliances, various therapies, technical they were using. Now they are coming back to this manual therapy and manipulative therapy, which Professor Sandil has got better idea. He is a well-known physio with us today, and he will be explaining how do they do. But these are really being implemented in the field of sports and effectively working. We only have to just think of that, how does it work, where it really affects that one. And the basis of physiology has to be really is a very, very important part of that, so that we can make a effective strategy in a better manner, understanding that what is actually happening. Is it happening at the level of neural level? Is it happening at the local muscular level? Or is it we are trying to push certain hormones, or we are trying to prevent certain things, blood flow or whatever? All those things have to be very, very clear. And in case we are clear physiologically what is that mechanism of this particular process is, possibly we will be able to make it a better the strategy for recovery, regeneration, his treatment, his rehabilitation of the sports person. And I think in the fellowship program, we will be taking care of this part also. And we all know that this physical therapy is very important. Physiotherapy, all of us are mostly physiotherapists here, and that is the best way to your even recovery, the recovery management part. If we have to do for athlete, if we have to manage the pain, if we have to manage some fall, improve certain balance, improve mobility, it is all actually neuromuscular coordination part and certain repair and regeneration part. And from the fatigue aspect, if we look into that, in sports, it is the recovery management of the athlete. It is the managing the overloading. It is managing overtraining of the athlete through this all physiotherapy, therapeutic means and method. So this is very, very important to now we have to understand this. Even, very a few weeks of your sport, soft tissue mobilization, that has got some effect on tissue stiffness, which a sports person keeps getting very frequently. The problems of all of us will understand that shoulder, internal rotation, horizontal reduction, because they are going for the maximum movement. And the evidences have been created that this mobilization can help us in, again, regulating the functional part of this various joints, various system of the body. And even in other evidences, I was going through various researcher also, that this manual therapy is helping in various muscle stiffness and stretching. If we do it, it can even improve the range of motions or and reduce the risk factors also in future. So if another evidence which was given, a 4-week treatment program of manual therapy and dry needling demonstrated a significant improvement in pain pressure thresholds, muscle elasticity, and stiffness of neck and shoulder muscles. So if you can see this evidence it is really proof that this helps us in regulating the functional part and making them again to have normal function, and also feel that it will lead to the better adaptation of the athlete, because with injuries, with pain, they will not be able to take the next load, and immobilization of this soft tissue can help them to recover in a better way, and also they can improve the range of motions in because that is very, very important to change that biomechanically. If we see these sports specific injuries, they again, it will be dealt in detail. Various injuries are there at different level, different joint, different muscles, different. Not only this, so that they are being hit by the ball is that is a, maybe it leads to different place, but they are more prone to injuries in different joints, where we have to keep more care through preventive method, and during the training time itself, and after the training also, if we can see all those aspects, they will be a better adapted athletes, and they can lead, that can lead to the high performance. And that, I think, can be done by utilizing this soft tissue or manual therapeutic techniques. And in contact sports, it's a big challenge again. The dislocation, fractures, concussion, contusions, pains, strains, severe injuries at the head level, injuries, internal organ trauma. Both the aspect here, we have to deal with this manual therapy or this myofascial or soft tissue management, that prevention as well as rehabilitation or treatment part also, and it is visible in the high performance sports. I think in this fellowship program, we can take it much more deeper and utilize this information and this advanced technique which have come up with the help of these experts. We will try to introduce in this. And in hockey, football, and other sports also, the similar kind of injuries are existing, where we will be able to manage it through this soft tissue. What is this? Basically, the manual therapy which works at the joint-based, muscle and connective tissue based, and the technique based biased toward the neurovascular system and cardiovascular aspect. So at different joint it can work, at different tissue level it can work, at the functional level of this blood flow it can work in different way, and that is where we have to understand the physiological part of this. Even if we give any mechanical stimulus, this particular model is divided into 3 zones. If we see this in the zone 1, it represents that mechanical stimulus is given to the by the provider to the patient, and that mechanical tissue is working on the tissues, and that will lead to the various modulatory circuitry which can reduce the pain also, and it can also work to the on the peripheral nervous system, and the pain related brain circuitry and spinal cord, that will lead to the pain inhibition in the third zone, we can say, and the clinical outcome is possibly it will be reduced. So in the if we think of this neuromuscular part, I hope I am not fast. Neurophysiological effect, if we see, then it is that immediate changes in neurophysiological function are observed after manual therapy. So manual therapy can lead to these neurophysiological changes, which are again leading to different changes in the muscle or tissue levels also. Reduction in inflammatory markers have been also seen by this particular manual therapy. There is a decrease in the spinal excitability and pain sensitivity by this manual therapy. Modification to cortical area in the brain level, which is involved in the pain processing, and excitation of the sympathetic nervous system, which leads to the changes in the different parts of the human system. So this I'm not going more into the detail but particularly the evidences which have been again seen, that has shown us that it can statistically significant increase in serotonin on beta endorphin level, which is after 5 minutes of spinal manipulation. There was 168% increase in the endogenous cannabinoids, and which was after post manipulation. These endogenous hormones are essential to control make a pain relief mechanism that works, and it is seen that these are changed by the soft tissue or even manual therapy. And the second way which we said is spinal excitability. Manual therapy modifies the state of spinal excitability, which was indicated by immediately decreased of nociceptive flexion and reflection, and also reduced temporal sensory summation, which represents a combination of reduced facilitation and increased inhibition of nociceptive input into the central nervous system. And supraspinal system also it works, which it involves supraspinal system in mediating the treatment effects of manual therapy, which has been corroborated through the observation of concurrent hypoalgesia, which is the reduction in pain in response to a standard stimulus. That is, which is very, very important for sports, that even if you give more stimulus, the pain is not that much. And also excitation of the sympathetic nervous system in relation with the application of MT techniques. For example, changes in heart rate, blood pressure, skin conduction, or skin blood flow, decrease in heart rate variability, salivary MLI, these are enzymes, and salivary cortisol level, insulin levels are also noted after manual therapy. So manual therapy leads to these certain changes at the enzymatic level, cardiovascular level, blood pressure is also changed here. And that is what is very, very important for us to really make it more recovery, better recovery, regeneration, and rehabilitation processes. And at the peripheral mechanism also, the musculoskeletal injuries reduce inflammatory response in the periphery, which initiate the, again, healing process is that we have to reduce inflammation and the pain processing. That is, again, by the manual therapy, it is evidences are there. And inflammatory mediators and peripheral nociceptors that interact in response to injuries and manual therapy may directly affect this process. And there was again observed significant reduction in blood and serum level cytokines in individual receiving joint biased. And additionally, the changes in blood level of beta endorphin, serotonin, and endogenous cannabinoids have been also observed by the manual therapy techniques. So these are all leads to the decrease in the pain, and also the cytokines are decreased, which leads to the changes and inflammatory changes also are reduced by that. So these are various soft tissue techniques that will be explained, and maybe Professor Sandil will tell that in how it works and what all how to do it also, and what all their physiological impacts are there. These are various techniques which have been evolved, and my again request will be, let us have this program a successful program of fellowship. Let's join together and make it much more successful. All your professionals as well as the experts, various experts, they can join and make it a better program. And thank you very much for giving me this opportunity to be a part of this discussion and seminar. Thank you, Professor Imam. Thank you, Professor Arshad, and my colleagues from Indonesia, and Sandil, Dr. Sandil.
Excellent, excellent, excellent. Thank you so much, Professor Kana. Really excellent. Okay, let me what is called there are very important thing, but I don't want to explain ini. Saya tidak akan menjelaskan secara detail lagi. Saya cuma mengharapkan kalau bisa teman-teman ini membuat pertanyaan. Ada beberapa hal penting yang tadi disampaikan oleh Profesor Kana yang disupport oleh evidence, riset evidence yang disupport oleh riset evidence. Yang pertama adalah beliau menyampaikan secara detail terkait physical therapy for chronic sport injuries. Beliau menjelaskan secara detail tentang physical therapy for chronic injuries. Saya mengingat ada beberapa ya, jogging, competitive sport, from muscle strain, ligament tears, dan lain-lain ya. Kemudian the best way to cope with the sport injury sudah disampaikan. Kemudian both recovery, manage pain, prevent fall. Ya, ini catatan-catatan saya. Kemudian improve balance dan lain-lain, mobility and prevent, mencegah injury yang selanjutnya. Kemudian beliau juga menyampaikan tentang beberapa hal terkait dengan neurophysiological effects. Ya, beliau menjelaskan ke kita tentang neurophysiological effect, terutama terkait dengan beberapa perubahan immediate change terkait dengan fungsi neurophysiological ya, yang bisa kita lihat after manual therapy. Kemudian beliau juga sudah menjelaskan tentang reduction in inflammatory markers, decrease spinal excitability. Beliau sudah menjelaskan tadi. Kemudian excitation of the sympathetic nervous system, ya, terkait dengan sistem saraf, beliau juga sudah menjelaskan kepada kita secara detail ya. Kemudian beliau juga menjelaskan tentang supraspinal system, ya, di situ beliau menjelaskan tentang spinal system mediating manual therapy has been corroborated through the observation ya of current hypoalgesia. Kemudian beliau sudah menyampaikan beberapa contoh perubahan-perubahan in heart rate, blood pressure, kemudian perubahan di skin conduction of skin blood flow, decrease heart rate variability, salivary amylase and salivary cortisol, insulin level, ya. Itu semua hal-hal yang bisa bermanfaat terkait dengan manual terapi ini. Selanjutnya beliau juga peripheral mechanism, ada beberapa hal yang beliau sampaikan terkait dengan peripheral mechanism, ada terkait dengan muscular injury yang menyebabkan respon pada inflammatory, kemudian inflammatory mediator and peripheral nociceptor. Beliau juga sedang menjelaskan dengan detail tadi. Kemudian significant rejection of blood and serum level cytokines. Ya, ini didukung oleh penelitian ya Theodorich
ya et al. Tahun 2006 ya. Ini sangat bermanfaat. Can change of blood levels, endorfin, serotonin. Ini juga didukung oleh beberapa peneliti ya seperti McFarland et al. 2005 ya. Kemudian yang terakhir adalah mengenai soft tissue techniques. Ya, beliau tadi menyampaikan bahwa di soft tissue ini will be explained by Profesor Sentil. Beliau menyampaikan ya ada hal-hal yang terkait dengan soft tissue. Saya ingat massage, manual lymph drainage, soft tissue mobilization, scar mobilization, myofascial release, craniosacral therapy, ART, active release technique, joint mobilization, joint manipulation, thrust, muscle energy technique, mulligan technique, and traction. Yeah, mulligan techniques. Maybe I'm not also familiar with this, Professor Kana. I hope that there is.
Yeah, I'm not that much,
Yeah.
all this basic.
Yeah.
I think Dr. Sandil can.
Dr.
give
Sarah
this
really excellent
of this.
So I think I have explained, summarized important thing based on Professor Kana presentation today.